Good morning, everyone. Glad you're here. So this training will take care of your requirement for, you'll get a certificate at the end of today or whenever you watch this after the fact, because this will be recorded. It'll be on the CEU Online School. It will be available for you immediately following, and then you can keep that on file for your licensing renewal. So we'll talk about all of that in a moment, but let me tell you a little bit about what we will be talking about today. So, here's the thing. This training that we're going to talk about today, the things we're going to talk about today are more about some of the struggles. It's what are the requirements, some of the laws, why the laws exist, what our role is, but we're really going to spend time talking about, as therapists, how hard it is to make reports for a number of reasons. The things that we kind of think of as low-hanging fruit and the things that may be a little more complicated. This is not a training of how to recognize abuse necessarily. That would be a whole separate training. DCFS has some really nice trainings on that. I would suggest that you do that as well, because the number one reason that reports aren't made is because it falls through the cracks, because we don't recognize that abuse is occurring. So we need to make sure that we can do that as well. But this is going to talk about some of the struggles that we have when someone discloses to us, when we have suspicion of abuse or neglect. We'll talk about what some of those entail. We're going to talk about what do you do? How do you make a report? We'll give you that information, that you can do it online, the timing of all of that, what you can expect in terms of, should you do it anonymously, or what are the arguments for doing it not anonymously? I mean, there's just a lot of things for us to consider and to think about. And again, why are some of these things really difficult for us? So that's what we're going to talk about today. Again, please feel free to use the Q&A box. We will make sure to check that. I'll pause partway through. Chris, you can kind of keep an eye on that. And if you see something that you think we ought to stop and really address at the moment, I would be glad to do that as well. So let's go ahead and get moving. All right, so this training, we are going to, well, of course, now it's not going to advance itself because it's just going to be that day. There we go. So again, we're not going to go through who all are the mandated reporters of the world. That's not, it's clergy, it's teachers, it's coaches, it's anyone who comes into contact with children or has responsibility for children. For our purposes, it's really all of us that are licensed, and really you have to do it once a renewal cycle unless you are an employee. If you're an employee, you have to do it annually. If you are an independent contractor, you have to do it annually as well. But if you're in practice by yourself with your own shingle, you can do it when you do it, just sometime during your renewal cycle. So what exactly is mandated reporting? What that means is, and I think, most of us probably know this, we're going to talk in a little more depth about this, but it means that by law, we are required to report any suspected abuse of children, endangerment of children, or neglect of children. Required by law, AKA we don't get to choose. This isn't a place where clinical judgment reigns supreme. It is the law. It's, it's up there with anything else that, don't carry a handgun in public and, whatever, it's up there. You are mandated by law. You don't get to opt out. You are required no matter what. So that's really what it means to be a mandated reporter. And for therapists, this is really important. And I will tell you, as a practice owner, I've had a lot of conversations with people where they've said, well, but, I don't want to breach confidentiality. And I think that trumps, HIPAA trumps mandated reporting. No, it is the other way around. In every other circumstance, first, it's in the state of Illinois, this is true. The state of Illinois statutes around confidentiality even trump HIPAA. Then the next layer is HIPAA, but above that is mandated reporting. So there is no option here. And this is why making sure you talk to your clients, we have these lovely forms, I'm sure you do too, about what are your requirements, what are your requirements, what is required of you as someone who is in your position as a therapist. Around confidentiality, when can you and must you, not can you, but must you break that confidentiality? And here is the number one tip I would give you. You know, a lot of folks here upload these forms, sign it, send it back to me. We never discuss it. We never go through it. People have no idea. They don't really understand because they didn't really read it. I mean, how much of the fine print do you read, right? When you go to your doctor's office, it pops up and like, oh yeah, sign on it, you know, can I just go in for my appointment, please? And so that's true for everyone. It is so important. And the number one thing you need to talk to people about when they come in is mandated reporting. So that if and when it happens, you've already had this conversation with parents, you've already had this conversation with kids, you've already had this conversation with everybody, so that there's no surprises. And we're going to talk about how you use that information if you need to. It is absolutely the leg you will need to stand on, because you're saying to people, look, I am required by law. This isn't optional for me. I can lose my license. I can go to jail. This is a class A misdemeanor. I mean, it's like, there's all kinds of things you can tell people if I don't report this. So I would not wait till after the fact to make sure that I have discussed with people about what my requirements are. First session, right out of the gate, make sure that when they sign that paperwork, they know what they are signing. I say that about other things too, but make sure that they understand what your fee structure is. But for our purposes today, make sure that they understand about mandated reporting, because that as a therapist is going to help you immensely should you get into this quandary. So let's just take a quick quiz. If you can enter in the poll, not the poll, I'm sorry, just enter in the Q&A box. How many of you have had to make a report in the past? Yeah, raise your hand, whatever. Please just let us know. How many of you have had to make a report? Yeah, Chris, can you see numbers?
I can. Right now, we've got 11 who have answered.
Okay.
Who have had to.
Mm-hmm. Okay.
13.
Mm-hmm. Okay. All right. 18 have raised hands. 17 a lot of folks have raised hands. So a lot of us have been in this position where we have had to make a report. None of us ever want to have to do it. And here is what DCFS says to us about us. We are their early warning system. That's our job. Part of the reason mandated reporters are so important, and that, when all of this changed a bit in 2021, in January of 2021, when guess what? We had to take all these trainings, or 2020, we had to have all these mandated reporter trainings and had to have the sexual harassment trainings. There was a bit of an expansion about who is included. Now, we've been included in this group for a long time. Why? Because people come and tell us things, or we observe things that other environments may not know or may not have the knowledge to be able to recognize. So DCFS considers us their early warning system. We're the ones who are going to see it when it's happening. So hopefully, but again, we want you to make sure that you get training, but we are the early warning system. And that's really, really important. And we're going to talk a bit more about that, because most of us don't like being in that position, especially in private practice. We don't like that for a number of reasons, partly because of the relationship we have with the clients. We don't want people to drop out. We don't want people to pull their children. We don't like conflict, generally speaking, as therapists. So it's kind of a big deal, but we are the early warning system. So I want you to think about this today, not just as your mandate, not just as avoiding a fine or some jail time or whatever if you fail to report and something bad happens, but also making sure that you kind of have that mindset of we are just part of this system of protecting children. And as I'm sure many of you know, during COVID, the numbers of reports actually have not gone up, but the amount of abuse has gone way, way up. So it's because parents are so stressed. There's so much, I mean, there's just so much going on in the world. So obviously that's part of the reason that it's so important. So have you ever not reported abuse? And you can raise your hand or not if you want to. I'll tell you, there was a time in my career when I didn't know as much about this, and I should have made some reports that I didn't make. And I used what I thought was clinical judgment, what I thought was best for the kid, what was best for the family. I didn't want the kid to be pulled out of treatment. I didn't want the wrath of the parents. This happened when I was working in a therapeutic day school. And it's where I made my first reports, and it's also where I didn't make my first reports. So just think about it for a moment. Has there been a situation where maybe you didn't report? And if not, why not? Why didn't you report? Just take a moment and think about it. So anybody raising their hand here?
Margot, there's a question. Are we talking about children or adults as well?
Where we didn't make a report about an adult?
Right. Yeah. The question is, are we just talking about children at this point? We are we not?
We are, yeah. Mandated reporting is primarily about kiddos, and we are talking about kiddos today. And we'll talk about what do you do if there's a report about someone who is already over 18 or above. So.
We also have another one here, Margot. I have, however, been told not to report by administration and needed to do so anyway.
Yeah, that, right. That is, well, first of all, good for you for doing it. If you did, I'm glad you did. I hear you. There are some administrators who will think that there is a rationale or a reason to not report. Now, these are tricky judgment calls, it feels like, right? That there might be some good reason not to. And we sort of see this, you know, any of you have made calls, it's scary. We feel like we're, you know, doing something that's not in the best interest of our clients sometimes. Are they going to get taken and put in a different, worse environment? Are their parents basically nice people who, you know, something happened and they didn't mean it, or they're not aware? I mean, these are really tricky situations. So to your point, there are administrators who will say, no, you are not to report. Well, guess what? Even if your supervisor says don't report and something happens and you didn't report, you're on the hook. And nobody's protecting the child, right? So that's, I mean, let's just stipulate to that we're always first and foremost talking about protecting the child. And I think we need to protect you as well. So your supervisor, your administrator might say, don't make a report, because you always need to talk to your supervisor, administrator, or practice owner. I ask people to please let me know when something like this is coming down the pike. You know, here's the thing. DCFS, if it's not a report that they can take, they're not going to take it. If it doesn't actually have any validity, they're not going to take it. It will be, you know, they're going to say, I don't think we have enough here. So you don't have to make those judgment calls, but I hear you. It's tricky when your supervisor is telling you to do so. So we'll get more into that. So, right, I think many of us have been in a situation where maybe we thought, oh, you know, what's going to happen if I do report? This kid's going to bounce out of treatment. Then what are they going to do? They're not going to end up back in therapy again. This kid needs therapy. That is, from our staff and for myself, the number one concern. Absolutely the number one concern. So how do we balance out the requirement with our clinical judgment? It's complicated. That's what we're going to be thinking about in part today. So here are some reasons why we don't, just what we were talking about. The disruption of the relationship, that's enormous. We're very concerned about that, right? Are the parents going to get angry with me? I will tell you that in everything in the literature that I have ever been able to find, there are ways to do this, to make a report that can minimize some of that damage to the relationship. You can't always. I mean, you can't You can't always, you don't have that kind of control. You don't have that, your crystal ball works as well as mine does. But there are ways to make sure that people are not shocked by this happening. And we're going to talk about how to do that. But that's the number one reason we're worried. Also, we're not even sure if it was that abuse? Does that count? Does spanking count as abuse? Were there marks left from a spanking versus did they hit them in the face with an open hand? Neglect. Well, so they have a house and they have food, but they seem unkempt. They're kind of dirty. I mean, what is it? Neglect? How do you know? We're just not sure. We don't know what we're looking at, which is why taking more training on exactly what constitutes abuse and neglect is why that's so important, because we want to be able to have that decision tree, right? Just like making a diagnosis, you want to be able to say, but here's the thing, bottom line, we don't have to make that determination. We need to make sure we don't miss it. We don't have to adjudicate it. We don't have to be the judge and jury of that. We just have to make sure we don't miss it. So also fear of conflict with the caregiver. As you can imagine, caregivers get very upset. I had to, I can think of times I've made the call and I've had to then call and tell the parent. And oh my gosh, I mean, today I have my hair up in a little, ponytail. It's probably actually big enough to be more like a man bun, but whatever. My hair blown back, like it felt like the skin was going to get singed off my face from them screaming at me. It's not easy. We're pacifists by and large as therapists. We don't like that. We like to help people feel better, right? Nobody wants the conflict with the caregiver. So these in the literature are the top 3 reasons why therapists don't report. And I would say probably number 1 is we just miss it. We absolutely miss it. We don't know what we're looking at. So back to my original point of make sure you get more training in that. So you do, but those are the number 1, 2, and 3 reasons why therapists don't report. So let's talk about and I'm sorry, I hate wordy slides. If I'm talking about a clinical concept, I rarely have really wordy slides, but I want you to have this verbiage with you. So that when you download the slides or go back to look at them, you've got it in front of you. So you don't have to go and look up, what exactly is reasonable cause to believe? That's the legal language, reasonable cause to believe. So as a mandated reporter, you are required, AKA you do not get to choose. You aren't using clinical judgment. You aren't seeing if this is best for the family and the kid any more than you get to say, well, yes, arrest this person, don't arrest them. Or we just don't have that. Right, perhaps we should, but we don't. So feel free to advocate down in Springfield, but right now this is where it is. So you are required to report suspected abuse or neglect when reasonable cause to believe. Now, isn't that nice and clear or murky? That a child known to you in your professional capacity may be an abused or neglected child. Now, your next door neighbor could see something happening across the street and make a report. They're not required, we're required, but they can make the same report that we can. It's just that we're doing it in our professional capacity. If you're doing it as a private citizen because it's somebody across the street, that's not actually a thing. You are a therapist wherever you go. So you are a mandated reporter even at home. So reasonable cause to believe, that's a little bit murky.
Margot, excuse me 1 minute. I just wanted to point, there's a comment in the Q&A regarding wanting to add the considerations of systematic oppression and racism impacting who gets reported and who does not.
Absolutely. And we actually are going to talk about that.
Okay.
Thank you for bringing that up. In much of the research that's been done on reporting, the researchers were trying to address this issue. So thank you, whomever brought that up. The researchers were trying to address this issue. Like, look, folks, there is so much systemic racism here. So let's just talk about it for a moment. We will absolutely assume, and this is just statistically, right? I'm talking about the literature. I'm not necessarily speaking about you specifically. We globally, as therapists, as anybody who's a mandated reporter, are much more likely to see what's happening in a family as abusive if the family is of color whether we are of color or not. That is just the reality of it. The preponderance of calls that go in are on kids and families of color. It is part of systemic racism. There are folks who are doing, I think, some decent research into this to try to understand this better and to bring data, because we can say it all day long. You know it, I know it, we can say it all day long. But as you know, in order to get people to begin to consider an argument, you have to have data. So there's some pretty good data about this at this point that appears to be true. So really I'm so glad you brought that up now. If the family across the street from you that you are reporting is of color, chances are much more likely statistically that someone is going to make a report about that family than they will about yours if you're not of color. And you might have done the exact same thing. So, but we will try to cover that a little bit more, but I'm glad you brought that up now, because it's a huge, huge problem, because there's over-reporting for families of color and then there's under-reporting for families who are not. And in terms of what gets investigated, what reports are taken, far more likely, because they do ask about the race of the child and the race of the family. Well, it's much more likely that a report will be pursued if the family and the child is of color versus if they're not. Where they live matters. Their socioeconomic status matters. As we know, kids in really rich areas, I mean, I know some folks who work at New Trier in Winnetka, and they will say, absolutely, there's abuse all the time. It's a very different experience for those families. They are much more likely, when the worker comes to the home, to have a report dismissed. Because when they come to your home, they will talk to you, they will look in your refrigerator, they will look in the bedrooms, and they will look to see what your fire preparedness is. And if you're articulate and you can explain what happened and it was a single incident and your home is lovely and your refrigerator is stocked with fruits and vegetables and other good foods, and you have a wonderful set of, integrated into your electrical system, your fire detectors, that's a very different story. So part of it is SES, a huge part. A part of it is color. Again, an enormous part. So thank you for bringing that up. And how tough is that on us, knowing that, and then being told you're a mandated reporter anyway, right? That's a really tough position for a therapist and a family potentially to be in. And we're going to talk some about some of the cultural stuff that goes into this as well, because in some cultures, you smack your kids, you hit them with items that leave marks. That's how they were raised. Their grandparents were raised. Everybody from generations back were raised that way. Here it's illegal. Now what? So we will get into that. So thank you very much for bringing that up. I mean, I don't think we can emphasize that strongly enough. So again, back to what exactly constitutes child abuse. And we're talking about kids under the age of 18. And we'll get to what do you do if somebody comes to you and reports something if they're over 18. But we're talking about kids where you have some reason to believe there's abuse or neglect and they're under the age of 18. Once they're 18, that is the cutoff. If they're 18 in one day, it's a cutoff. And the abuse can happen by a parent, a romantic partner, anybody living in the home, a babysitter, a daycare worker. Again, I think some of these things are obvious to you, but we have to cover them anyway because this is required content for this training to count as a mandated reporter training. So if you know this, I apologize, but stick with us. We'll get to the other stuff. It's really any person responsible for the child's welfare, healthcare provider, coach, youth volunteer, clergy. Clergy is big. That was really emphasized once this change happened in mandated reporting, were clergy, and for reasons that we could spend, several hours discussing. So the mistreatment can result in injury or put the child at serious risk of injury. So that doesn't, it could be that they did something and the child wasn't injured, but they really could have been injured, right? Leaving a kid in a car, on a super duper hot day Well, maybe they came out and they survived, but maybe they wouldn't have, right? Parents who have forgotten their children in the car, I guess it could happen, but okay. But that would be one example of something where it could have resulted, but it didn't. Or, the child has a head injury. Well, they could have died, but they didn't. Or they could have had a concussion, but they didn't. Something that happened, right? I worked with a family where the parents thought it was okay to take their child's head and bash it into a pipe that was in I apologize, this is trigger warning, I apologize, into a pipe in their apartment, just boom. Well, the kid would go to school with knots. And so, of course, a report was made, and which is how they ended up coming to me. And guess what? The parents got better at turning the kid around and bashing him on the back of the head. So, there's a lot that goes into this and what families need to not make these kinds of parenting decisions or lose their cool in this kind of way. I mean, I'd like to say it's not really a parenting decision when you're at that state, but it puts the child at risk, or they either are at risk or have had a serious injury. There's bruises, broken bones, the usual things you think of, fondling or incest, but also emotional that results in real psychological injury or mental illness as a result. PTSD, right? I mean, if a child is coming to school or to you and has PTSD, and it's because of things that have been happening in the home, it could be that they were terrified, frequently terrified, never touched, but frequently just terrified that fear was used as a weapon. We're going to kill your animal. We're going to send you away, or, things that cause kids to really be frightened. Those are all the things that certainly count. But again, more training on that. So let's talk about Chris. Chris is a lovely younger social worker. Oh, hang on. It looks like there's something in the Q&A. Chris, is there something we should attend to?
It was acknowledgement. Thanks for raising that question. And thanks for addressing it.
Great. So this is Chris. Chris is a lovely young social worker. She's been in the field for 4 years. She works part-time in private practice with adolescents, but also works at a community mental health center where she works with kids and adolescents. And she has had, and families. She is, smart, really very committed to her clients. And she's also had some real struggles because it's not always as clear as we would like it to be. So, how do you know? These are sometimes some of the judgment calls we're up against. So let me tell you a little bit about Alima. Alima is a woman of color in her 30s who emigrated from Mozambique 5 years ago with her husband, Ian, and their 4-year-old son, Uran. It's Y-U-R-A-N, Uran. We'll call it Uran instead of urine. That sounds better. Alima hopes to sponsor her parents to immigrate to the US, but is finding the process really complex and challenging, which, we know what immigration is like these days, but that's a stress for her. She's used to living in a culture and an environment with lots of family, but now it's just her and her husband. So her husband's not home a lot because of work. It's tough. And so in addition to all of that stress, she's trying to get her family here. She's here by herself. She's had to learn a new language. Her husband's gone a lot. She's used to communal living. Her son's teachers have been contacting her and talking about aggressive behavior that her son has been demonstrating against other kids, like screaming, hitting, grabbing toys, that sort of thing. And Alima disclosed an incident that occurred at home because Chris asked her, so what did you do when you found out that your son, Uran, was doing these things at school? And she said, well, I hit him in the face with my open hand and on the buttocks on the backside, the butt several times with a wooden stick. She said, this is how she was raised. This is how her family was raised. Everybody's done this forever. Corporal punishment is a thing. She was stunned that because the child did have some marks that were left behind, there was some bruising on the backside, that DCFS could be contacted. And she said, this is really traditionally sanctioned in my culture. She was so confused. Nobody had talked to her about mandated reporting on the front end. And she felt really betrayed and really ambushed, like she had trusted Chris. She had trusted the agency. She had trusted the school. And she was just genuinely confused. Like, what are you talking about? Now, here's the thing. I don't know how many of you are parents, but when my kids were, I think my older son had to be in kindergarten. So he's 17 now. So this is, a number of years ago. He came home one day and said, Mom, now we didn't spank our kids, but he said, Mom, if you spank me, I can report you to the government. It's like, you are 5 years old. What are you all doing? What, you're at lunch talking about how you can turn your parents in? Like, what is this? What did I talk about? I'm sure I talked about whatever, watching the Flintstones or something. Anyway, whatever. But so no, she was not aware that this was a thing that could even happen. Like, that was so unheard of to her. So it really, really was confusing to her and very disruptive to the relationship. So what would you do in this situation? Would you make the report? So she had this treatment done to her. Would you make the report? It's traditionally sanctioned in Mozambique. Yeah, Margaret Berger raised your hand. You would, yeah, okay. So yeah, anybody else? I mean, would anybody else? What was the thing that I said? Megan, yeah, what was the thing that I said would make you say, I have to do this? I get it. Alima, I hear you. I really get it. What is the thing that would cause you to make that report? Anybody? What was the one thing I said?
The marks, the bruising.
The marks and the bruising, right? If there are no marks and no bruising, would you still need to make the report? That's one of those things. If there's no marks and no bruising, there's no evidence. So then you start thinking legally there's no evidence. Now you, again, do not have to make this judgment call. You can call DCFS. You can call anonymously to ask a question. You can call anonymously to make a report, but we're going to talk about some dilemmas with that. But you can call anonymously to ask a question. And you could say, look, this is the situation. Woman, immigrant, Mozambique, traditional, blah, 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 no marks. And let them say yes or no. You don't have to make that decision. But once there's marks, bruising, that's really the dividing line of where you are now in mandated reporter territory where you must call. Certainly some psychoeducation for Alima about parenting and other strategies. What she also said was, well, I tried some of those other things you recommended and they didn't work. Well, okay. So in her mind, you gave me some dumb ideas and they didn't really work very well. My stick and my hand work much better. So you want to come and control. I've had people say this, you want to take my child, you want to get my child to behave, you want my child to cooperate, you parent them, right? So again, people don't like this. This is really hard. But so this is part of the quandary. This is certainly a situation where you could call DCFS either way and say, here's my situation. Is this something you would investigate? Again, you're not making that determination. I think I've said that several times now, so we'll move on. Neglect. Neglect is tricky. If a kid shows up in school and is dirty and has no lunch and has no lunch money, and that's much easier to see. And then guess what? What if it's because of poverty? Right? What if that's the situation? You have lovely parents, and there was an interstate compact, I want to say about 20 years ago, where a law was passed, or was it a law, an interstate compact? Anyway, it was determined that poverty alone was not a reason to remove children. There was a reason to trigger giving resources. And that still exists. Now, does that always happen? No. I wish it did, but that's the way it's supposed to happen. If, for example, you notice that a child is just really unkempt and doesn't have food and, all of those things, and you know it's probably because of poverty, that the parents are there, they're nice people, but they're amongst the working poor, they're out of work or whatever the case may be, or they're working 3 jobs and there's just nobody there to take care of the kids. Well, what do? What is that like? Now I'm going to call DCFS on you. Here's the thing. We think of DCFS as being the people who come in and take the children away. There is also a mechanism by which you can trigger support. You can trigger someone going into the home and providing services, someone going in and helping that family get resources, get money, get a food card, get what they need, get housing if they don't have it. So that is a part of DCFS. Now, we all know the system is far from perfect, but that is a part of it. Neglect alone, or not neglect, poverty alone is not a reason to remove a child, because children prior to 20 years ago, poverty, out you go. Well, are you kidding me? How about we provide resources and support for those parents who are disabled or unable to work or whatever else is happening? Or if there's an addiction that's happening, get that parent treatment if they will do so. And perhaps the kids sometimes do have to go into temporary care with relatives. That's always the place they'll start. Is there a relative? I don't know of workers, I'm sure it's out there, but who are just looking to take kids and put them in strangers' homes. Often they're looking like, hey, is there anybody who can take, any family member who can take this child? And then that's the backup if they can't. And as we know, there are problems in foster care as well. So the system has its own set of challenges. But if you see that, or there's medical care that a kid needs, well, what if it's their religious right to determine that, right? And they'd say to you, look, we are Christian Scientists. We're Jehovah's Witnesses. We don't believe in this. God will heal us. I mean, there was a fair amount of this happening during COVID, folks, where we don't need to wear masks or socially distanced or get vaccines because of our religion. And that's a true thing. I mean, for some folks, that's a true thing. It wasn't just that they didn't believe in vaccines and so they invoked some religious reason. It's really true. They just don't believe in medical intervention. It's God. God will take care of them. Is that reportable? Are they required? You don't have to make that decision. But if you see that a child is repeatedly sick or has a broken bone and is not being attended to, you need to call, right? That's what the law says. The law says you need to call. Hopefully, the first line of defense is going to be getting resources to this family. So again, I hope that's enough disclaimers if I get it that the system is far from perfect. So
Margot, real quick, before you go on to the next one, there are a couple questions out here. One being one of their clients was married to a Chicago police white officer who was abusive to his kids. His wife was pretty passive and disabled. The clinician did call DCFS, but they did not follow up. Mm-hmm. Are there other steps that could have been taken?
Are there other steps that could have been taken? Oftentimes, DCFS will respond when there's more than one report. So they might kick back the initial report. Sometimes you can report to the police, but the police will say call DCFS, or they will call DCFS. Police officer on police officer, again, there are, we know how systems work, folks, but there are methods by which you can call and say there is an officer who is impaired, and maybe there'll be an internal investigation or some support. But by and large, if DCFS didn't take the report the first time, you are looking for the next opportunity to make that report again. You are hopefully on the front end. And I always try to get releases on the front end. When I first start working with kids or families, let's get a release with the school. Let's get a release if there's somebody else on the team. They have an OT or a PT, and it's just coordination of care. Sometimes people obviously don't want other providers to know or the school to know or whatever. You can't always do that, but if you can, boy, then you do not have to ask for their permission within that 1 year of that release being open. You can contact the school and say, are you seeing something? I made a report. Nobody, DCFS said, forget it. If somebody else calls, it's great if you call back too. The more times you can call, but you have to have an incident. There has to be something you're calling about, not, hey, I reported this before and nobody followed up on it. Well, did anything new happen? No, but I'm still worried. They're going to say, sorry. But if somebody else, the OT, the PT, the school, if they've seen something and they can also call, the more calls that go in, or you see something again, or the child reports something again, the more likely it is that somebody is going to do something on their end, because they have to track all of these calls. And then their neck is on the line if there have been multiple calls on a kiddo or a family and nobody did anything. Nobody did anything. So that would be my suggestion. Try to coordinate with other care providers if that's available to you, if you have those releases, and also keep your eyes, you're like a hawk looking for any evidence of something else to call again.
Great, thank you. And there's one more, and this is a question, is would it be possible to make sure that people from other countries be given the heads up on our laws and what constitutes abuse and neglect when you're signing the treatment consent? Then just the comment that cultural sensitivity needs to be considered.
100%, folks. Yes. It's not only possible, I would say when you are going over your initial paperwork, because they may have never heard it before. So this might be your first opportunity for some education for them about our laws in this country. And you do this with somebody who's from here, not from here, I think it's 100% the same, because they may just not be aware that what they're doing constitutes something reportable. Or they may not think that it's an actual thing, or, DCFS is for those, other people who live in that neighborhood. And so make sure you go over what is a mandated reporter, what sorts of things, and don't just blow through it. Any child abuse, any neglect, any sexual abuse, no. And this is what constitutes, right? If there are bruises, if the child is, showing real signs of stress because they're talking about, or, you can even talk with some folks about in their play. If I see something, I might have to be curious about that. But absolutely, and we're walking that fine line of not wanting the parent to drag the kid out of there and say, do not ever, ever tell anybody anything that's happening. I mean, I can't tell you how many families I've worked with where that was the case. And then the kid discloses something and now they're sure their parent is going to just do them in. I mean, it's so tricky, but you want to make sure you're talking about minimally. Look, if your child has marks on them, if you use corporal punishment or any kind of physical punishment, if you withdraw or withhold food or shelter, if you do not take care of the child's basic physical needs or medical care, these are situations. If the child is touched inappropriately by somebody, if that lives in your home or is in your network, could be a neighbor, all of these constitute mandated reporting, and I am required by law to make sure that that call gets made or that report gets made. So yes, 100%. Thank you for bringing that up. That is that opportunity. It's when you're talking about informed consent. Okay. So neglect, tricky. So this is John. John is a Caucasian man in his 40s. His wife suddenly passed away in a car accident, leaving him to be the sole caregiver of Sally, age 6, and Flora, age 9. His wife had been a stay-at-home mom and was the full-time caregiver for their daughters. John's a warehouse worker who works day shifts with occasional overtime in the evenings. The staff at his daughter's elementary school have expressed concerns because the children look dirty. They have a pretty strong body odor. Other kids are really making fun of them. They've been observed playing outside late after school. They don't have adequate clothing for winter. They're outside with no boots and their bare feet, no coats. During session, John disclosed that he's been so depressed and so upset and so overwhelmed that he's been taking sleeping medication so that he can get some rest, because he just wasn't sleeping and he has to work. Somebody has to support this family. And so sometimes that causes him to sleep through the morning routine, and the kids do get up and go to school. And sometimes he sleeps all day because he's taken more than maybe he should have. So he's telling you this. He maintains that the older daughter is really good. She takes excellent care. Flora is 9. She takes great care of Sally, makes sure that she, gets where she needs to be and has some food. there's food in the house, right? They have shelter, there's food in the refrigerator. You make sure there's things that they can eat. There's peanut butter and jelly sandwiches. You know, they don't have to make filet in order to have something to eat. They've got food they can make. And he says, come on, they are old enough to take care of themselves. Kids have been doing this their whole lives. You know, his dad died when he was younger, and, you know, the kids kind of had to figure out how to fend for themselves. What's he supposed to do? He can't sleep, work at his job, and take care of these kids all at the same time. It's just too much, especially because he has this really adequate 9-year-old to take care of them. And he keeps saying that, you know, there's nothing really to worry about. You people are just making much more of this than there needs to be. What would you do? This poor guy, his wife died. He's trying to, you know, support the family. How many of you would think this is actually reportable? Anybody want to raise your hand? Yeah. How many of you think it's absolutely reportable? And what's making you think it's reportable? There's no marks left on these kids. Chris?
Yeah, we have 7 hands raised.
Okay, great. And why would you, or why wouldn't you? What would be an argument for not making this report? Anybody? Probably the number one reason would be compassion for this poor guy, right? We're therapists, this poor guy, right? And he's bringing his kids in to see Chris. He cares about them, right? Look at what he's been through. What if I just give him some parenting? What if I just help him with that? What if I just help him and I say, look, this is what you need to do for your kids. Please be sure. And this is a place where therapists do sort of get into the weeds, because we think, I will do parenting education. I'll say, look, this is reportable. You have 1 week to turn this around. And if it's not turned around, the school can call DCFS. I can call DCFS. I mean, wouldn't you want to give this poor guy a break? Would anybody feel that way?
We have some comments here about being outside without shoes might be a reason to report, wanting to get more resources for the family, inadequate supervision.
Right. So again, can we think about DCFS as not just being the people who take your children away? But I actually had this happen with a family recently where one child had been getting violent with the other child in the home, and DCFS was contacted, and they went out and talked to the parents and said, we just want to see what resources we can provide for you. Because it didn't rise to the level of, you know, we're going to take this child away, but it did rise to the level of, we're making a call and we're going to come and talk to these folks and see. So I was really impressed by that. I thought, I hadn't heard that before. It wasn't my case, but fascinating. Like, oh, they actually really do that. Now, we could argue they'll do that more in some neighborhoods than in others. Would they do this for John in a way they wouldn't with Lima? I don't have any idea. So, you know, again, there's all these unknowns. Would that be reasonable? Well, if a kid dies of hypothermia during that week that you were waiting for John to turn his act around, what happens then? I mean, obviously, horrible tragedy for this child and this family. And what happens to you? What kind of hook are you on? So just something else to consider when we start thinking about these things. You can also call DCFS and say, look, this is the situation, this poor guy, would it be okay if I did this? And they might say, call me back in a week. Or they might say, nope, we've got it from here. That's why you can call anytime and get that information. Okay. So criteria needed. The kiddo is under 18. There has to be an incident or a set of circumstances that would cause any reasonable person, whomever those reasonable people may be, AKA, presumably us, that the kiddo was, or the children were being abused or neglected. What happens when you call? If you haven't called before, try to talk to somebody who has. It can feel very intimidating. I've made many, many calls. I can't say that it's ever been a bad experience. There have been times where I have not gotten a live human. There have been times when I haven't had the outcome that I wanted because it was really clear to me, but you know, here's what will happen. A worker is going to answer the phone. They will ask you questions to gather the information. So there are things that you need, and I'm going to tell you in a minute what those things are that you need. And they're going to make the determination of whether to take a formal report. Again, you don't have to do that. If there is enough information, they'll tell you so, and they'll answer any questions that you have about what to do next. And they will tell you, if they say there's not enough yet, please, please, please see if anybody else has information and they can report, or if you see something else, you call us back immediately. That's what they will tell you as well. If a formal report is taken, an investigation specialist has to begin that process within 24 hours or much sooner if it appears like there's an immediate risk of harm. You can call the police if you think there's an immediate risk of harm. You can call the police, but you also have to call DCFS. Calling the police alone is not enough. Once this is all, if there is a formal report, they have 60 days in order to wrap this whole thing up. So there's a chunk of time that they actually have to complete their investigation. So you're still in the mix. It's not like, okay, I've made the report. This family and these kids might still need you. They likely will. You have to do so within 48 hours. That's required by law. You have 48 hours from the time of suspicion to talk to a supervisor, talk to a colleague, get consultation, get yourself prepared, talk to the family, which we'll talk more about in a minute. Everybody loves those sessions, as you might imagine, within 48 hours. And we'll have this information again. It's 800-252-2837. Or if it's not an emergency, they really are requesting these days that you submit to DCFS online reporting.dcfs.illinois.gov/. I mean, you know, they did not make it easy. So this will be available to you as well. It'll be in your handouts about how to contact DCFS. Here's what you have to have at the ready. Name or names of the family, the kid, siblings if possible. Dates of birth or approximate ages, because you may not know, depending on the situation, if it's a neighbor across the street or, you know, but if it's your client, obviously you would know, or if it's somebody else that was reported on because of the, you know, because you know, somebody else comes in and tells you that this thing is happening and you think, oh my gosh, I know about this now, I should do something about this. If they are not your client, you're actually not required, but it's still a good idea. You want to know as many specific details about the incident or circumstances as possible. The when, the where, and the how. You're never asking a kid why. Why do you think that? I mean, that's who knows? When, where, and how, if you know. And all you can give them is what you can give them. If you don't think you have enough information, don't worry about it. Still give them what you have anyway. What do you do if you're not absolutely sure that abuse or neglect is occurring? Like, I just don't know. Let's think of it this way. So what percentage of abuse or neglect cases go unreported? 30, 50, 70, or 90? You want to enter that quickly in the Q&A? What percentage actually go unreported?
We've got a 50, a 70.
Okay. The one who said 70, you win the microwave oven. 70% of abuse or neglect cases statistically nationwide, this isn't just in Illinois, go unreported, 70%. And how many adults were told about the abuse or neglect, told or given an indication before the report is made? Guesses in the chat box? We have another microwave oven to give away. Toaster oven, maybe this time.
We've got a couple threes.
7, which is stunning, right? Why would that be? How can so many people be told and nobody does anything? Now, I'm not saying 7 therapists were told, 7 people. It could be a teacher. It could be a parent's friend. It could be another kid, but this is also adults. On average, 7 adults were told before a report is made. So upwards of 70% of abuse goes unreported. And an average of 7 adults were told before a report is made. So if you're not sure, do you want to be in that 70% or 1 in 7 adults, one of those 7 adults? And you just got to think of it this way. But you don't have to think of it anyway. I would suggest you think of it this way. Think of it how you want. But every delay in reporting increases the likelihood that something more is going to happen, right? We like to think we have more influence as therapists than we do. What might happen is if you try to talk to the parents, they're going to tell their children to shut up. You do not talk to anybody about this or you're really going to be in trouble, right? So are you the one to really make that determination if you're going to take that 7 days or 14 days or month to get that parent to turn around? 1 in, 7 out of how many, right? I mean, ugh. So by trusting your own gut and common sense and instincts, and call the hotline whenever you suspect a child has been harmed or is at risk of harm or neglect, you can ensure that it's not going to be that 70% or 7 adults who did nothing. So my suggestion is make the report anyway. You have to decide, but the law says make the report anyway. So, sorry, you can't really read this graphic very well, but what if I'm afraid that the relationship with my client will be disrupted and the client is saying to the therapist, I've been wanting to ask, doctor, who died and made you king, right? I mean, that's kind of how it can feel like, who died and made you king? And we can feel like, oh, who died and made me king? Who put me in charge of this? I don't want this responsibility. When faced with a report, caregivers can get really upset. There's a lot of betrayal and stigma. I mean, there's this, Tufford has done a lot of research in this area that's good. I would suggest looking into it. There's denial, there's blame, there's all kinds of anger. Of course, they're humiliated, they're confused, just like the parents we talked about. We don't want to rupture that relationship. And of course, the stronger your relationship, the better. So when our team is working with the parents, boy, all of us need to make sure if we're working with a child that we have a really strong alliance when possible with those parents, unless there's some reason we really can't. We need to have a strong alliance. Even if we don't like what they're doing, even if we don't like how they're parenting their children, we still need to have a strong alliance because there might be times that we need to step in and have conversations with them and or make a report. And all change with a parent is going to be based on their relationship with you. All right, so strategies for maintaining. We talked about maintaining the relationship and reporting. You want to discuss your legal duty. We talked about that. And you want to involve the client. Now that sounds like craziness. Craziness. What do you mean I'm going to involve the client? You're going to review those informed consent forms on the front end. You're going to talk on the front end about information about DCFS. You're not just going to say, I have to make a report. They may have no idea what you're talking about. Report to whom? The news, like who are you reporting to? This is who DCFS is. This is what they do. This is how I would contact them if this comes about. Now, I will tell you the response I've gotten from several therapists over the years is, well, but then if I tell them all that, then maybe they'll tell their child not to tell me anything. Yes, that might be. That might be. I mean, we can't control for all the variables, but this is really what the law is asking of us. And this is what the research says is the best way to go. In order to maintain that relationship, talk to colleagues, get consultation. You're doing affect regulation for you and for them, right? For the kid, for the caregivers. You want to consult, process with colleagues, talk about your fear. If you need somebody to sit with you while you make the call, I have sat with our staff while they've made the call. I have at times actually made the call on their behalf because they were like paralyzed. There's more work to do there when that happens, let me tell you, but we just need to get this done in our 48-hour window, and then we'll work on what needs to happen for them. I mean, I'll make the call and hand the phone. I don't have the information. Let the caregivers and kids have their feelings and process them. You need to listen to what they're going to say. And if you've prepared them well enough in advance, you're covered. You're not ambushing them. And they can say, I can't believe you think that that rises to that level. Here's the law. This is what rises to that level. And I don't get to decide that. This agency decides that. You want to make sure that you're advocating and you're really letting people know, look, I am behind you. I am behind your family. I'm hoping we can get more resources, but we also have to follow the law. I can't imagine you wouldn't want me to break the law and risk losing my license. That doesn't make sense. And you want to make sure that you have reinforced the positive parental attributes. And guess when you're doing all of this? Before the call. So when I'm talking about involving the parents, and again, this is in the literature, this is for folks who do this a lot, who work in child welfare, reporting after you have talked to the family. Let them know. Now, there are circumstances, and I can't say these are always this is always the right way to go. You do have to use your clinical judgment about how do you do this? Do you do it anonymously? Do you involve the parents? That's really clinical judgment. Do I call or do I not call? This is how do you call and what do you do to prepare the family? Involving the parents, where you sit down with them and say, look, so that knock on the head, that's against the law. I have to call. I have to, oh, please don't, please, 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 they'll take. That is not the only thing that DCFS is about. Remember when you first came in and we talked about DCFS wants to protect your child. They want to help you if you need other resources. They might just recommend parenting classes. They might not take it at all. I don't know what they're going to do. That's not really up to me. I can't make that decision. I'm going to be right here with you. I'm going to support you through this. I will tell them all the things I see about you that are really good as a parent. And then I will tell them, the parents, the caregivers, what I think are really good attributes. You've been a great aunt. You've been a fabulous grandmother. You've been wonderful. I couldn't have known that he was sexually abusing her. I didn't know. I know you didn't. And of course, your crystal ball works as well as mine does. And this isn't about getting you in trouble. This is about following the law and making sure that you and your family and your child get all that you need so that you can be okay. Well, what if I never say to people, I can guarantee something one way or another, because guess what? I can't. I'm realistic with them, but we'll get back to that in a moment. I want to refer people to community supports, especially if there's a cross-cultural, cross-ethnic, cross-racial issue. That's just part of the dynamic. I want to make sure I give them community supports and professional supports within their community from people who are more similar to them than I am. I had a family that I worked with when I worked at this therapeutic day school. It was a family from South Korea. And I remember the kid would come in and she'd have marks on her head and, what happened? Just my father took off his shoe and boom, would hit me on the head. I was like, oh my gosh. So I finally talked to the parents. I said, I have to call. They begged me not to. I said, I have to. I called DCFS and had to make the report, and they did the investigation. But I also called a Korean community service agency, community mental health center that serviced a lot of Korean folks. And I spoke with a therapist who's from Korea, who specializes in working with Korean families. And he said, oh yeah, probably when those folks were growing up, you could be standing on the street corner. If somebody did something you didn't like, they'd take their shoe off and they could bap you on the head, and that was perfectly legal. Okay. So they came out, they talked to the parents. The parents, they didn't take the children away. They said, look, you must get yourself into some parent education classes about how to. But where I sent them was into the Korean community, which at first they didn't want because they were embarrassed. I said, look, let's see if we can find somebody who you don't know. Because they said it's a small community. I don't want people to know about this. I said, they don't have to know why you're there. They just, you're coming so that you can get more information about how parents are required to discipline children in the United States. So they did. So I sent them, I got this information from this guy. I gave it to them. They went to him. He gave them some more resources. So you want to make sure that you're giving them professional support that's really appropriate for them, not, middle-aged white lady on down. What if you don't call? All right, I think I've been pretty clear about that. Some people are worried, well, what if it's a false report, like it's not real? Don't worry about it. You have immunity from any liability if you make a mistake. If you do it maliciously, like you're doing something ridiculous, no. It's when you don't call that you're going to have a problem. And I referenced before, it is a Class A misdemeanor, folks, which is the most serious misdemeanor crime in the state of Illinois. Maximum punishment of up to 364 days in jail, fine of $2,500. Now, have I ever known anybody to go to jail for this? No. I've asked our attorney, has he known anybody? No. So now, does that, I mean, that's just to allay the fears of like somebody's going to come back and get you, but they could, especially if something happens to that child, that same child who's outside, who freezes from hypothermia and dies, or, dies from hypothermia. That would be a perfect example, right? That if you didn't make the call and somehow it came out, you have it in your notes or something happens, you just don't want to be in that position. And of course, I don't think we make these decisions because we do and don't want to go to jail. We're just afraid. We don't know what's going to happen. Like when we get subpoenaed, our notes get subpoenaed. I'm going to do another webinar on notes. That's not a thing you really have to worry about so much, but we'll have that conversation another time. But this is actually important. And I have to go back and do some more research on this, but from what I understand, when these changes happened in 2020 with changing these mandated reporter laws and making sure that people are reporting and knowing who the mandated reporters are and getting training, I wouldn't be surprised if more of this does happen, and it would probably look more like a fine than jail time, but who needs it, right? I mean, who needs it? So can you just tell your supervisor, I'm going to go, right? So one of my staff comes to me and says, this has been happening. There you go. See ya. No. You can't. You're still on the hook. Telling me now just puts us both on the hook, but it's my job then as the supervisor to go back and say, okay, you need to call DCFS. You have to. Telling me is not enough. That doesn't count. What if somebody, I think this is on a listserv this past week or maybe the week before. What if the person is over 18 and they're telling me about being abused as a kid? So here's the thing. If they know where the perpetrator still is, if they don't know where the perpetrator is, there's really nothing that DCFS can do. If they don't know the names, if they don't know the location, the person is deceased, obviously they've moved, they don't know where they are. There's nothing DCFS can do. If it's a neighbor, if it's a relative, and they know that they still have contact with children, absolutely call the hotline, right? Do they have access to children? If they don't have access to children, you can call your local law enforcement. They may look up to see, are they on a list of child perpetrators? They may or may not do anything, but that is what your legal right would be. Can you make an anonymous call? I've referenced this a few times. Absolutely, you can make an anonymous call. I do that more when I'm trying to fish, right? Like, is this something you will take? Or I'm murky about this. Tell me, what should I do here? And they will say, give me your name, give me your name, give me your name. And you can say, no, no, no. I am strictly trying to get information. They will say, you must give me, are you a mandated reporter? You must give me your name. No, I am calling only to find out information at this point. Now, since you are a mandated reporter, at some point you are going to have to give them more information, but you can say, I'm just calling, here's a child, 13 years old, this is the situation. Is this a report you would take? Well, I don't know, I need more details. Then you have to decide, is now the moment, but you can call. And often, I will tell you, I mean, I've had that happen on a couple of occasions where they were pushing more for that. They've said, let me tell you, yes, I think this is something, or no, are there any marks? No, I can tell you we're not going to pursue that. That's most of the time. It's a friendly discussion. Well, I don't know about friendly. Collegial discussion. It's not friendly. It's collegial, but it's not hostile. Like, tell me more, but they might ask you for that, but you don't have to give them that information. Here's the problem if you don't. So these are judgment calls on your part, folks. If you're going to make it an honest report, they can't contact you to verify the information or gather more information, and it weakens the investigation, right? So you might be making the call and then sort of tying one hand behind their back. You won't be notified of the results of the investigation, so you won't know, do you need to keep looking? Did something happen? Are they taking care of it? What was the outcome? What happened to this family? You may have absolutely no idea. And if something happens to the child, you have no legal proof that you fulfilled your mandated reporter requirement. So you have to decide. We're going to go through these fairly quickly because some of them I think are, fairly obvious, but I want to just cover when a child discloses, let them talk. Listen to them, don't interrupt. Try to get down to their level. Ask very open-ended questions like, tell me what happened, not, did he touch you here? You are not an investigator, folks. Do not try to act like an investigator. To say, well, I need to know so that I know, in your own mind, I need to know, so if I know I should make a report. No, tell me what happened. Is there anything else? Can you tell me more? Good therapist questions. Language that's appropriate to a kiddo, and make sure you take them seriously, because I've had therapists come to me and say, I don't really believe it. It's not up to you. You still have to go whether you think you believe them or not. Talk to them, give them praise for being brave, reassure them, tell them what you heard, write it down in the kid's words, not yours. You stop and you go back and you say, I want to make sure I get all of this right. And you can write it down. Let the child know that you have to tell somebody who's going to help them and who's going to help their family. And make sure you always tell the truth. Do not overpromise. Don't tell them things that you can't make sure are going to happen. That's a really bad idea for obvious reasons. Thank them for confiding in you. Keep the information confidential. I mean, we know that. I don't even have to tell you that. Confidential, not from DCFS, not from your supervisor, not from a trusted colleague. You get the idea. And you have 48 hours in which to make that report. Do not promise confidentiality at any point during treatment ever. Don't promise confidentiality about these kinds of things. Don't panic, right? The child, think about mirror neurons. The kid is going to be watching you, or they might be looking down and looking up at you. Get yourself composed. Don't have the conversation if you are freaked out. Go leave the room, say, I will be right back. I'm just going to go to get a drink of water. Do you want a drink of water? Get yourself composed and then go back in. Ask, do not ask suggestive questions, and do not respond with information or words the child did not already use. Make sure you don't put any words in their mouth, because if there is an investigation, you are in trouble. You're in trouble, not in trouble, you're going to get in trouble, but you're going to muck up the investigation, because now they've got other words to describe it that may not be what actually happened. And especially if you have a kid who's young enough where fantasy is still predominant in their way of seeing the world. So you are only taking information. You are a sponge right then. That's it. Don't make negative comments. Don't ask why. No negative comments about the perpetrator. I can't believe they did that to you. That's so horrible. Children feel very protective, as you might know, of even their perpetrators. So you're just going to be super neutral. If they cry, oh, honey, that hurt you. I'm sorry you felt that way. That's okay. But you're not making it, you're talking about them and their feelings, not about the perpetrator. Do not talk to the child more than once. Don't make them repeat their story. They're going to have to, if there is an investigation, they're going to have to do this multiple times. They don't have to go to your supervisor and repeat it, or no. The DCFS hotline and the investigators will take care of that, and potentially the police. And don't determine for yourself if this is valid or not. Oh, I took that information. I don't think it rises to the occasion. Call, ask a question, go on a fishing expedition. Here is the information you need. Again, this will be in your packet. The hotline is open 24 hours a day, 365 days a year. There are fewer people on holidays, of course. Again, I gave you the things that you need to be able to ask people, or not ask, that you need to tell the investigator or the person taking the report. If it's an emergency, please call the police. If you think the child is in imminent danger, call the police. You can do that and then call DCFS. If it's not an emergency, just go to the DCFS online reporting system, or you can make a phone call. Either is fine. Thank you everyone for joining us. Hope to see you next time. Be well.